Now we need to have care outside of one of the two facilities. You are using your Blue Select Plus network, all right? And I'll show you the hospitals, but you're familiar with that already. If you are on the Blue Select Plus plan right now, then you know those hospitals. All right, so they're listed here, but I do also want to remind you it's an EPO. So that means you have to use the doctors and hospitals that's part of Blue Select Plus. If you have an emergency, that emergency is covered. All right, the care center addresses are listed at the bottom, and it's also in your little guide. The extended network, your benefit, if you're going outside of the care center for that hospital procedure, you need to see a doctor. Good example, new mom, newborn, you want to use the pediatrician, the primary care physicians. You can do that and use that Blue Select Plus pediatrician or that Blue Select Plus OB-GYN for your maternity visits. That care would be subject to a $1,000 deductible or $3,000 for the family. And it works the same way. It's embedded, as we described before, where one person in your family would satisfy that $1,000 individual deductible. And then after that, you have 100% coverage. So you'll see that your deductible and your out-of-pocket maximum, they match. So this is your total potential exposure. I will also have you note, I have listed here the network benefit. If you use a non-network provider, no coverage at all. All right, also see at the bottom your prescription drugs. So any prescription that you get in the care center, that generic prescription would have a $15 copay. Retail, if you go to any other pharmacy, Walgreens or Target, and it's in that second tier, $50. Specialty drugs, those kind of designer drugs, fall into the third category, and they would be subject to the deductible if you have not satisfied that. All right, and then you have your mail order right below. Let's say you get that short-term prescription drug at the care center, and you need help getting that long-term maintenance medication through the mail order. The Care Guide can help you with that. I know that your current plans have that value-based incentive program. If you're taking advantage of that program through your current plans where you get that reduced copay, if you have one of those conditions like coronary artery disease or diabetes, there's a list of conditions where you can get either a reduced copay or no copay on the current plans. Keeping in mind, Spira Care would not have that available. So as you're making your plan decision, think about those things, all right? I don't want someone to already be using the value-based incentive program and then get on the Spira Care plan and still have some costs for their prescriptions. If you have a relationship with the doctor, so that's some of the things that you'll need to ask yourself. The doctor that I have a relationship with right now, are they part of Blue Select Plus? And if the answer is yes, could this be a good option for me? Yes, it would. Why? Because you can have your care at one of the two locations, some of your primary care if you want to. If you decide I want all of my care with my Blue Select Plus doctor, you can do that. And then the discounted cost of that doctor's office visit would be subject to that $1,000 deductible and then covered at 100% after that. So that could be a good option for you. So you won't get phone calls saying you need to come into the center. Think of it kind of as a three-part program, all right? You have the care centers that are available for you to use, then you have that extended network, and then outside of the Metro KC area, you'll have the Blue Card network that we'll talk about in just a minute. So just like it's your option right now, if you're on Blue Select Plus, to use doctors or hospitals in the network, nobody's going to call and say you need to do this, that, or the other. This is the same concept. We're just giving you an opportunity to have all your primary care in one place. And then if you have to have some extended care, then you have that connection with your Care Guide and with your doctor outside of the care center.